Okay. So today we're gonna talk about pulp protection. What is pulp protection? It is actually the measurements that we should take into consideration when we are dealing with deep dentin caries. You know, caries progress so quickly within the dentin tissue. Why? Because dentin is a living tissue and it has a lot of dentinal tubulars and uh, has a high amount of organic material in comparison with enamel. So when the bacteria start to produce the acids and start to demineralize the inorganic component, this acid will affect also the organic components and will cause denaturation of the collagen, and thus the both structure of both components of dentin will be affected by the acids and will progress the caries into deep and deep layers. So the restoration and maintenance of dental health through adequate restorative treatment in order to protect pulp function is one of the main purposes of restorative dentistry. Whatever is the depth of the restoration, each material that is applied on the tooth in the teeth, or even the presence of the bacteria, the presence of mechanical forces, the presence of acid attacks, all of these stimulus together will affect the health of pulp, and pulp will respond to these stimulations in its way. Like if the stimulation is very low and very mild, then the pulp will, because of the presence of immunoglobulins and interleukins, white blood cells, will try to compensate for these stimuli and will heal itself. But if the stimuli will become moderate, then the response of pulp will start to change. So all the time, pulp is doing his function by protection. And when we think about doing restorations, we should think about the biomechanics. We should think about toxicity of the materials and also the technique, the best technique of placement of these materials in order to decrease the stimulation of the pulp, in order to make it as mild as possible, in order to preserve the vitality of the pulp. The dental pulp is a soft connective tissue of mesenchymal origin. And within this tissue, you can find odontoblasts, fibroblasts, nerve endings, arteries, veins, and a lot of ground substance materials. In addition to the white blood cells, macrophages, and neutrophils, and a lot of immunoglobulins, interleukins, all part of immunity system. Also, we have the lymphatic system within the dental pulp, because whenever you have blood circulation, also you're gonna have lymphatic system. So dental pulp is a soft connective tissue, but it consists of complex structures, of complex of cells and components. And as you know, pulp is located within the crown and also located within the root. It is not considered an external tissue. Yes, its exposure to external stimuli is unceasing due to several factors that make the pulp extremely sensitive to the environment. And we talked about it. Actually, the in this lecture, you're gonna find part of the slides are taken directly from the book, and I advise you to study from the book. because if you didn't get something from my lecture, maybe you can understand it from the book directly. It is written in a very simple way. Some important features of pulp are the followers. First, pulp is located deep within the tooth. Why it is located deep within the tooth and it is surrounded by dentin and enamel? Because pulp is soft tissue and we need hard tissue to protect this soft tissue. Like what when we need the rib bones to protect the heart, okay? So we need this protection. It gives radiographic appearance and radiolucent line, yeah, because you know in the radiographs or in the films, X-ray films, the hard tissues that has high amount of hydroxyapatite and inorganic components will appear radio opaque, and the soft tissues or caries or disease area will appear like radiolucent. Pulp is a connective tissue with several factors, making it unique and altering its ability to respond to irritation. Yes, and that's why, as I said, you're gonna find the blood circulation, lymphatic circulation. You're gonna find connective tissue cells like fibroblasts, and at the same time, you're gonna find white blood cells. So these complex of structures will make it unique and will facilitate, okay, and will facilitate the protection function of pulp. Normal pulp is a coherent soft tissue dependent on its normal hard dent and shell for protection, and this is what we explained. Once exposed extremely, it is sensitive to contact and pressure and kind of stimulus sometimes, temperature, not pressure also. So contact, pressure, temperature, mechanical, chemical, biological stimulations, all of these things can affect the pulp. So pain does not last for more than 1 to 2 seconds after the stimulus removed, and this is what is called sensitivity. But if the pain continues, then it is an indication of pulp infection and it is an indication of pulpitis, which may lead at the end to the endodontic treatment. Since pulp is totally surrounded by a hard tissue, dentin limits the area for expansion and restricts the pulp's ability to tolerate edema. What does that mean? We mentioned that we have blood vessels inside the pulp. So when there's a stimulus, pulp will try to protect the vitality of the tooth and will start to release white blood cells. And you know, as each part of the body, after the injury or the stimulation, the blood vessels will vasodilate to provide and support the body organs with more blood. And thus, it will facilitate and accelerate healing. So, the blood vessels within this hard chamber will vasodilate. And as the space is limited, its ability also limited. And this is important when you study pulpitis. You know, in endodontics, if you have pulpitis, the moment you open the pulp chamber with your burrs, the tooth will start to bleed. And this bleeding is an indication of the congestion of blood due to the vasodilation within the limited space. So bleeding is an indication of infection and indication of edema. The pulp has almost a total lack of collateral circulation. Yeah, unfortunately, The blood circulation within dental pulp is very limited. That's why pulp could go for necrosis and could die under such stimulations like bacteria or mechanical stimulations. So that's why we as dentists try to behave quickly, try to apply preventive measurements to prevent the inflammation of pulp and irritation of pulp. The pulp possesses unique cells, the odontoblasts, as well as cells that can differentiate into a hard tissue, secreting cells that form dentin. And what kind of dentin they form? They form first primary dentin, and after that, they will form secondary and tertiary dentin. So, as a response of irritation, as a response of aging, you will find that these odontoplasts will secrete more dentin, and when more dentin is secreted, the pulp chamber will become smaller and smaller, and that's why you're gonna find that the pulp chamber in old patients is much smaller than it is in young patients. Is this something um, physiological? Yes, it is physiological. So, one of the changes that occur on the tooth during aging is the secretion of secondary dentin and tertiary dentin, and as a result, the pulp chamber will become smaller, and the also the pulp tissue will become less. Protection of dentin pulp complex is important factor for the vitality of the pulp, and we said that it is our purpose, it is one of our aims in restorative dentistry. It involves the avoidance of thermal stimuli during operative procedures. That's why we use hand pieces that has good irrigation system. You know, in the handpieces, you're gonna find three holes from which water will come out during preparation or during opening the cavity. Why? Because it will be used for irrigation, for cooling, and will decrease the irritation of the pulp. Also, we should choose the material that has less toxicity, that is much biocompatible for the pulp and the dentin in order to protect pulp. How we can protect it from the irritation? First of all, let's try to understand what kind of irritations do we have in dentistry. First one is the bacterial irritants like caries, trauma, which is like we can classify trauma like the like bruxism, which is heavy occlusal forces, or maybe sported traumas where the tooth is broken or after the tooth being injured, or it could be iatrogenic. What does that mean, iatrogenic? Iatrogenic means caused by the dentist. How the dentist can irritate the pulp. First of all, during tooth preparation, and we mentioned a few minutes ago the irrigation. But is it only the irrigation? No, we're going to talk about it in details now. By orthodontic movement of the tooth, yeah. By orthodontic treatments, we apply forces constantly on a tooth in a specific way in order to change its position within the bone. So, if the force is heavy or if it is directed in a wrong way, this may affect the pulp and may cause also external resorption of the teeth. Periodontal and periapical curettage. Yeah, which is the treatment of periodontitis using of chemicals, especially restorative materials, and idiopathic. Yeah, here you can see these pictures in this figure, which will facilitate for you to understand what kind of irritants we have. The bacterial, which are caries or periodontal diseases related, the traumatic, which could be acute or chronic, kind of acute trauma like sport traumas, tooth fracture, luxation, avulsion, all of these happen at a moment. But the chronic trauma is bruxism because it is something continuous. It is parafunctional. It is a habit for the patient. Yeah, these are the irritants. What about the iatrogenic one? Yeah, how the dentist can irritate the pulp during tooth preparation. First of all, by tooth preparation, because of the friction of the diamond burrs or the carbide burrs with the dental tissue at high speed, then the temperature of the dentin or the temperature of the tooth itself will increase. And the increase of 11 Celsius will cause destruction. So pulpal temperature is critical and must not exceed the normal value in dental restorative procedures. The clinical research has shown irreversible damage to pulp tissues at level of 60% when the temperature increased by 5.5 and to 100% when it increased at the level of 11 Celsius. So we should take this into consideration while working. So I need to do good irrigation, to use good burrs, because if the cutting efficiency of the burr is low, then the friction gonna be higher. So I need to use good burrs. I need to be sure that the handpiece is working efficiently. The rotation of the burrs within the handpiece is good enough to cut the specific area without loading more force or without causing cracks within the tissue. Irrigation, and after that, I want to do good isolation while working. In this picture, you can see how the preparation without water caused burn to the dentin. It burned. This is when you are working without water. This is a histological um, section in which you can see that there's a hemorrhage in the subodontoplastic vascular plexus in this pulp. The second factor that we should control while working or while preparation is the pressure. I mentioned that you should select good burrs with good cutting efficiency because applying pressure over the tooth will lead to pulp necrosis in a way, it will lead to degeneration in a way, because this pressure will cause the nuclear aspiration of the odontoblasts and also will irritate the nerve endings. So as a whole, this irritation will lead to degeneration. So I need to work with less pressure as possible. So I need to be sure that my machines are working very well, and I should not apply pressure while working. I should have this tactile sensation in my hand, in my fingers. The third factor that you have to take into consideration also is the remaining dentin thickness. Yeah, how much this caries is deep and how much it is near to the pulp. If I can leave a good amount of dentin over the pulp, then less irritation may happen. But if the remaining amount of dentin is very thin. And the dentin near to pulp has high permeability because the diameter of the dentinal tubules are higher and bigger. So I need for sure to use something to seal this dentin and prevent the irritant from reaching dental pulp. Again, we mentioned that we have idiopathic stimulations or irritants like orthodontic treatment by applying heavy force or wrong direction. And when we are treating the periapical abscesses, or when we are treating the periodontitis, the force that we use during curettage could cause pulp irritation. What kind of chemicals that we use in dentistry that may irritate pulp? Actually, all temporary and permanent fillings, bases, liners, and the oral hygiene materials, all of them has a cytotoxicity degree in a way. The most biocompatible material nowadays is ceramics, and all other materials in somehow they are cytotoxic, and its acidity or heat formation, or maybe as a result if they cause marginal leakage, in a way, as a result they will cause irritation for the pulp. So I need to be sure that I'm using the proper material for the proper cavity. Aging sometimes cause resorption, which could be external and internal, but aging when it is physiological without um, irritation, it will cause, as we said, it will cause the formation of secondary and tertiary dentin, and within time you're gonna see a pulp chamber that is decreasing inside. The most important irritant and commonly found irritant in dentistry is dental caries. How can dental caries affect the pulp health? First of all, you know that caries is bacteria that use nutrients, then produce acids, and the acids will cause demineralization. Demineralization will progress to reach the pulp in like this in this photo. And we said that at the moment the irritant start, the pulp defensive mechanism also start to work. So when this stimulation becomes moderate and over moderate, pulp will start to be affected and patient may feel pain. How this how or we can ask in this way, what are the defensive reactions that pulp can take to protect the vitality of the tooth? The first thing is the formation of reparative dentin, because when the dentin layer is becoming bigger, then the progress of dental caries will take longer time. So in this way, pulp is preserved for longer time. Also by sclerosis of the dentinal tubules, by forming sclerotic dentin. What is the importance of this type of dentin? It will decrease the diameter of the dentinal tubules and thus will decrease the permeability. And I think last year, you know that sclerotic dentin is irregular dentin. So the orientation and the composition of the dentin is different. That's why the progression of dental caries within sclerotic dentin is very hard. And also the third mechanism of protection by using its inflammatory and immunological reactions. We talked about white blood cells, macrophages, neutrophils, immunoglobulins, interleukins, and all these growth and immunological factors. Factors that affect response of pulp to tooth preparation. During preparation, we apply pressure, we apply heat, vibration, and also we discussed remaining dentin thickness. I mentioned also the speed of the handpiece that we are using and the nature of the cutting instruments. If you wanted to think about all the factors together, they could be summarized in this table. And accordingly, you have to think how to manage these factors. So in order to decrease the pressure, I should not apply pressure and should have good tactile sensation. I should use good cutting instruments. I should use good irrigation. I should be sure that the machine is working in a perfect way, so no vibration, no cracks. I should try to preserve tooth structure as much as possible, and I would prefer to use high speed to to do preparation of enamel and low speed to prepare dentin. Okay, this is the summary of this table. What about the chemicals or the restorative materials, how they can affect the pulp? They can affect pulp by changing the acidity. If we are using acidic materials, like after doing acid etching over enamel and dentin, it may cause sensitivity. Two, the absorption of water from dentin during setting, and this is related to the cement materials. Do you remember the cement materials and base materials? Some of them during setting absorb water, and when they absorb water, they will cause dehydration of the dentin, and this dehydration will affect the collagen matrix, thus will cause irritation. Some materials during setting will generate heat because, you know, as a result of the reaction, catalyst-based reaction at the end may cause heat. So heat generation may affect the pulp. And the best example of this is composite during setting using the light cure. It will generate heat. So we should control this factor. Poor marginal adaptation, especially in amalgam and composites and temporary filling materials. If we have a marginal leakage, it means the bacteria may pass to the pulp chamber again and will um, cause secondary caries. Cytotoxicity of the material, yeah. If the biocompatibility of the material is low, then the cytotoxic components of these materials will start to affect the living cells, which are usually the odontoblasts and the pulp, and sometimes they will affect the gingiva and soft tissue. So all these factors together, if we could control them, we can achieve a restorative material with best biocompatibility and without pulp irritation. This is the end of the first lecture, and we will move to the university system now. Okay?
Okay.